If this is your vibe, then hit that subscribe button, grab a drink, and let's chat.
I know, that's a cool intro. If you always wanted to work in the Cath lab, then stay tuned in this video because this video is just for you. But anyway, welcome back to my page. If you're new here, then my name is Alicia. So for today's video, we're going to talk about the Cath lab. I know a lot of you talk about soft life nursing jobs, and some of you may say this is soft life, but to me, it's just doing God's will. But let's talk about my experience working in the Cath lab. You already know we're on the big comfy couch, so grab a drink and let's sit down and chat. All right, so I wrote everything down. Cath lab is the house umbrella for Cath lab nurses and IR nurses. I'm going to be referring back to my notes because I wrote key points down that I do not want to miss in this video, because by the end of this video, the goal is for you to know if the Cath lab is the place for you. So, most commonly frequently asked questions: how are the shifts working in the Cath lab? You work 4-10 shifts, so it's usually 7 to 5, and you do have to take calls. So the way calls work is different from every facility, so follow your policies. Let's just say you get off, you work 7 to 5, you get off at 5. Your call starts from 5 to the next morning at 7, and you're still expected to show to work. Yeah, I know. That's why I couldn't do it. And also you have weekend call obligations, which some places can do a full weekend. So that weekend will start that Friday morning until Friday morning, the whole Friday, the whole Saturday, and then probably end Monday morning at 7 a.m. when it's time for you to go to work. And you can be called multiple times and you still have to show up. There is a time you have to get to the facility. Some places you have an hour from the time they call you to get there. Other places have 30 minutes from the time they get there. So let's rewind it back again. Cath lab nurses focus primarily on the heart. If a patient is having a heart attack, they deal with those things. A patient needs a stent or anything dealing with the heart. That's why they will get the balloon pumps, they get pacemakers, all these things heart related. That's Cath lab nurses. Next, you have your IR nurses. IR nurses focus on all other extremities of the body except the heart. So the difference with OR nurses and Cath lab nurses: OR nurses works with instruments and tools. Cath lab nurses, which is the umbrella for IR and Cath lab nurses, they use wires. So most procedures, your access points are usually the groin. It could be the right or the left, or it can be your radial artery. So those are the access points, access your jugular vein. But for the most part, it's usually the groin access. Post procedure, usually you're not to lift anything heavy. Your leg needs to be straight for at least 6 hours, or it depends on the sheet size. It goes by the size of the sheet, and that's how long you have to be flat, and so forth. Like I say, everything is different based on the hospital. Some procedures that we do in the IR department, you have your thrombectomy, which is pretty much removing clots. So they use different machines to remove those clots. Department in the cath lab that's called electrophysiology. So that department, sometimes you can have, at least where I worked, us IR nurses didn't do EP cases. So that's called EP cases, electrophysiology. So that was for the cath lab nurses, because the electrophysiology is basically the heart as well. So it's pretty much the electricity of the heart. So they work, so a patient has a heart rate that's uncontrolled, they will go to EP, which will fix that electricity of the heart and bring their rhythm back to normal. So usually that's cath lab nurses. They take EP cases, and they also take the on-call and the regular cath lab cases. That's that. So back to cases that we do in the IR department. We also may do atherectomy, which is removing of plaques in the arteries. So they will use laser or certain machines to get rid of that clot. And like I said, same thing, the access points are the same. Another thing they can do, pain relief therapy. I've seen that once, and usually they use pin needles. Usually sedated for these procedures. You can choose to be intubated, or you have no choice but to be intubated, or you can get mild sedation, which is usually they'll give you Versed or fentanyl. And I'm not going to get into that, but every hospital is different. They may have a particular med they give for sedation, and that's that. Other procedures they may do is IVC filters, which is pretty much like a web trap. I'm going to post a picture here to trap clots. You also have your angioplasty, which is pretty much you'll go into the artery. Let's just say there's an occlusion in the leg. They will go in with this wire and then go in with a balloon wire that actually balloons the artery, which is to open the artery so that way the blood flow can go and that person don't have any issues with that leg anymore. Balloons, usually patients have to come back and forth for that because remember, you're just temporarily opening the artery. It can close back. So that's another thing. We do angiograms, which is pretty much pictures of your arteries, pictures of your veins and arteries. You do venograms, pictures of your veins. Um, Another thing we do dialysis catheter placements. It can be temporarily. We do fistulograms, which is when a patient has dialysis, they have a fistula that's not working. We can go in there, remove the clots, and fix that fistula. Nephrostomy tube, bilateral nephrostomy tubes in your kidneys to get that working again. We also do stents. Let's just say you need stents in the artery or somewhere. You'll get stents placed, and circumstances vary. Um, let's see. Another thing, when you apply for these jobs, they will say that um, you don't have to work weekends. Let's rephrase that. Most jobs, you don't have to work weekends, but you do have to take calls. That's where they get you. So, just how when you work a regular floor in the hospital, you have to rotate calls. The same thing with IR and cath lab nurses. You have to rotate calls. So let's just say last year you didn't take a call on a New Year's Day. This year you may have to take call New Year's Day. So that means the whole day you're on call. Mind you, the department is closed, but you're still on call and you're on call with that specific doctor. So doctors do calls too, obviously. But that's pretty much the gist of my experience in the cath lab. Did I like it? I loved it. It was pretty chill. You don't have the patient for a long period of time, just in and out of procedures. You all go to break together. That's another thing. You go to break as a team. So you're not going to break by yourself. You go to break as a team because you're doing case to case. You, your scrub techs, and your physician. So you have to go and break on a team, come back as a team, and continue the cases. So I did like that. I did love the part of being days. You worked the 410s. But I did not like the on call. Honestly, it was a lot, especially being that I was a night shift nurse that was trying to get back onto day shift fully. So that actually was not working for me. But if this is something you want to do, I hope this video helps you. And that's my experience in the cath lab. If you like these videos, like, share, follow, subscribe. I have more videos to come. I will talk about all my specialties that I have tried and my experience in those specialties and tell you a little bit about that specialty so that helps you when you get out of nursing school or if you're thinking about switching specialty. Those videos are actually going to come into play for you. But anyway, this is my TED Talk on the nice, gray, comfy couch, and I hope to see you back on the couch. Bye.